for persons with intellectual disabilities or related conditions. A simple way to think about a waiver is the waiver waives off that hospital. It waives off a nursing home, waives off an ICF or a state-supported living center, and allows that person to live in the community and receive those supports and services they would have received in those different institutions, but receive them in the community, at home, where they can remain safe in the community. Now, what is a related condition? Some of the waivers, you need to have a related condition, and it's something that's attributable to cerebral palsy or epilepsy, or it's any condition other than mental illness that can be closely related to an intellectual disability, and it's something that has to manifest before the age of 22. It's likely to continue indefinitely, and then you have to have 3 or more of substantial function limitations in 3 or more of these 6 different areas of self-care or major life activities. Okay, so examples of related conditions: Down syndrome, tuberous sclerosis, which is small tumors all around the body, cerebral hemorrhage, like a traumatic brain injury from a car accident, quadriplegia, which is with non-movement in all 4 extremities, or paralysis, encephalopathy, which is normally somebody might be born with oxygen deprivation to their brain, and they have encephalopathy from that, the brain death and that type of thing. Muscular dystrophy, which is a genetic disorder with a progressive weakness of the muscles. Now, this website, I've checked all these websites on the presentation to make sure they all work, and they do. This one is a full approved list of all the related conditions that HHSC recognizes. Okay, now some attributes of these different waivers. They're supposed to be flexible. The point of a waiver is the state saying, hey, I want to provide additional services to a special group of individuals over and above what's already provided in regular Medicaid, okay? So it allows the state to say, hey, I want to give these additional services and to help this population of people. Now, a wide range of services and supports that they can put into the waiver. It's normal. It can be family and consumer driven. The waiver belongs to the person. So for example, if somebody comes up on the MBCP waiting list, and normally, like if that child has a disability, but they tried to get supplemental security income, right? Say the child's 8 years old, try to get supplemental security income. Well, what's the problem? Parents make too much money. Can't get SSI, can't get Medicaid, right? But if the person comes up on the MBCP waiting list and they get into that program, the parent's income is not counted towards that child's resource limits for Medicaid, and they can receive Medicaid as a result of being in that Medicaid waiver program. Belongs to the person, doesn't include the parent's income. Waiver services, there you have provider choice. You can, like, if you move around the state, you still have the waiver, and you have long-term options. The waiver eligibility, again, is based on the person, not the family. So if a child has 2 parents that make $200,000 a year, that $200,000 a year is not counted against the child when they are evaluated for eligibility financially for the waiver. So to get a little bit more specific, is that an individual can have 300% of SSI and still be eligible for the waiver financially. So that's about $22.50 per month now, as far as the top number that you could receive for SSI per month times 3. Okay. The problem, this might be a problem on this next bullet. States can decide the number of people they want to serve, the ages, the disabilities, etc. This kind of goes into money, right? The state can decide whether or not they want to put money towards that waiver, and that's why we have these waiting lists, because the state has decided not to put as much money as they could from year to year into the different waiver programs. One thing that the waivers can't do is they can't duplicate what's already in the Medicaid state plan. That would kind of defeat the purpose of having the waiver. If you could be in Medicaid and receive those services in regular Medicaid, why would you even need a waiver, right? So, so you can't duplicate services. They're not entitlement services, okay? Medicaid waivers are not entitlement. SSI and Medicaid is an entitlement if a child receives supplemental security income or an adult receives SSI. You automatically are eligible for Medicaid. That's an entitlement. But the waivers aren't. So that's why we have the wait list. Because it's not, just because you have the disability, just because you meet the eligibility criteria, doesn't mean you automatically get in the waiver. They have the waiting list and the money problems. And you can do consumer-directed services in all the waivers, but some services you can't do CDS or consumer-directed services. Okay. Now, when you're in the waiver, you get access to Medicaid if you didn't already have it. And that's in addition to the services that you get from the Medicaid waiver. And this is the state plan services that are not going to be in the waiver, okay? That everybody who is in regular Medicaid will get. Doctor visits, hospital visits, durable medical equipment, nursing services for individuals under the age of 21, skilled nursing services, personal care services for individuals under the age of 21, and community first choice, attendant care and rehabilitation. We were talking about CFC earlier, community first choice. That's a state plan service. You don't have to be in a waiver to get that. You have to be in Medicaid to get that. But these are things that are not in the waiver. Now, some things are in the waiver. Sometimes there's caps on state plan services. Like, say, for example, I don't know, let's just say, for example, diapers. A number of diapers that you may receive in state plan service, maybe, I'm just going to use this example, I may be incorrect, like a box a month that you can get state plan services. But your loved one has medical necessity for diapers, more diapers, over and above one box per month. So a lot of times the waiver will pay for the extra boxes over and above state plan services if it's medically necessary and it's covered by the waiver. Okay, here are some of the 1915C waivers. Medically Dependent Children Program, or MDCP. Community Living Assistance and Support Services, or CLASS. Home and Community-Based Services, HCS. Couldn't have come up with a better name than that? Because isn't this Home and Community-Based Services waiver?
Yeah.
Oh, whatever. The CLASS and HCS are considered the IDD waivers. People with intellectual disabilities, developmental disabilities. Then the Deaf-Blind Multiple Disabilities Waiver, or DBMD. I've never dealt with this waiver, and we'll see why in a minute. Youth Empowerment Services, Texas Home Living Waiver, and Star Plus Waiver, which isn't really a 1915C waiver anymore. The state of Texas folded it into an experimental 1115 waiver. So there is a bit of a waiting list for Star Plus Waiver now if you're not coming out of a nursing home onto the waiver. But it's considered an upgrade for if you're in Star Plus as an adult. You can upgrade to Star Plus waiver and not have to wait as long on a waiting list. Okay, the Medically Dependent Children Program. This is for individuals who are age 0 to 20. Once you turn 21, you can't be an MDCP anymore. It's an alternative to a nursing facility or a hospital. Again, like we said earlier, the income resource limits, regardless of parental income, as long as that child has resources that are less than 300% of the SSI. Most of these children are not going to be making a whole lot of money, so that's usually not a problem. The cost cap is, there's cost caps in all these waivers, okay? Like in state plan, there are no cost limits for the different services for children, but for every waiver, there's cost limits. It's usually not a problem for children who need MDCP, who are also receiving private duty nursing through the state plans, because the nursing is coming out of state plan, and they don't have to worry about the cost cap. And we'll talk about what services are in MDCP that go under that 50% cost cap. So the cost cap is 50% of what it would cost based on their assessment and their resource utilization group for the payment rate for an individual in a nursing facility. So they take it, what it would be for a year, and they chop it in half, and that's what the cost limit for that program is for a plan year. Okay, here are some of the services in MDCP. Respite services. This is very important for parents who take care of medically fragile or disabled children in the community. And it can be provided by a nurse or a personal care attendant. Payment rates are not always that great, but it is something that can be utilized. And it is utilized quite a bit in MDCP. Minor home modifications, if there's modifications that need to be done to the home to accommodate an individual's disability. Adaptive aids, employment assistance, supported employment, supports to enable children to participate in child care, and transition assistance services for people who are moving out of an institution onto the waiver, and coming into the community. That's the only time you can use the transition assistance services. Important facts about this waiver. Again, it commonly serves as a mechanism for children to receive Medicaid because they meet medical necessity for the waiver. Because a lot of times children, again, they can't get SSI or they can't get Medicaid due to income because the parents make too much money. But remember, when the children are in this waiver, you don't take into consideration a parent's income. So it allows them to get Medicaid as a result of being meeting medical necessity for the waiver. Now, children in MDCP they've been in managed care since November 2016. Senate Bill 7 from 2013 took care of that. Now, there are some bills at the legislature. You guys know about the Dallas Morning News articles that came out during the summer about some of the issues with Medicaid managed care. If you haven't, you should look at the Pain and Profit series. It's called Pain and Profit, Dallas Morning News. Just put that into Google bar and it should pop right up. They have a nice page that has all those articles. It had 8 different articles that dealt with the different issues ranging from foster care to MDCP, to adults, to fair hearing problems. The last article gives bullet points on what could be done by the Texas legislature to help alleviate some of these problems or fix some of these problems. So there's been a rush of bills that have been filed to help what they're calling, so not to alienate the architect of managed care, Jay Nelson, they're trying to call it modernize managed care to make it work better. It's not going to go away. But some people, some groups, and you guys may be familiar with Protect Texas Fragile Kids on Facebook, yes? They are pushing to have like an opt-out where children who are in MDCP can opt out of managed care and go back to receiving Medicaid through traditional fee-for-service, where you can go to any doctor. I mean, if you lived in Dallas and had a specialist in Houston, as it currently stands, unless that doctor has a single case agreement with a managed care organization, you can't see that doctor because they're not in network, right? But what if you had seen that doctor when you were in fee-for-service Medicaid for 5-10 years? If you were in traditional Medicaid, you could go to that doctor and it could get paid for. You wouldn't have to worry about these provider networks. And that was one of the problems that parents had when they moved from fee-for-service Medicaid to managed care, Star Kids. We'll see what happens at the legislature, but they're working on some provisions that might opt out or opt in. It may be automatic that they're in fee-for-service Medicaid and you have to opt into managed care. So we'll see what happens at the legislature this session. Children and young adults in the waiver, they access state plan services because they have Medicaid, and then and that includes private duty nursing and personal care services. Those are state plan benefits. You don't get those from the MDCP waiver. However, and we'll talk about it, we can talk about it later, but private duty nursing is not a state plan service for adults. Okay? That's why children have so much trouble who receive a lot of nursing services in children's Medicaid. When they turn 21 and have that transition from a children's Medicaid program to the adult Medicaid program, have a lot of issues moving over because of those cost limits that may be in those adult programs like Star Plus Waiver. And so it's because private duty nursing services are not a state plan service for adults in Texas. Consumer directed services, you can hire your own employees, some people are very familiar with CDS. You know, you can hire and fire your own employees. You have to have a consumer directed services agency that helps do like a lot of the background checks for the people that you'd like to hire. They also do a lot of the payroll and things like that. Money follows the person from a nursing facility. This is a potential way to skip the waiting list in MDCP, but it's got stringent criteria in order to meet the necessity for that. You can do a regular nursing home stay or a limited nursing home stay. If you did the regular nursing home stay, then your child would have to be in a nursing home for 30 days before they could come out of the nursing home onto the MDCP waiver. However, the limited nursing home stay is 24 hours, and it's not really 24 hours. But your child has to meet certain criteria and be so medically fragile that their health and safety couldn't be protected for more than 24 hours in a nursing facility. And that's not always easy to meet. But I've helped some children be able to meet that criteria, and then sometimes it doesn't work. But it's not really 24 hours for parents to hear that. Sometimes they're like, I don't even want, you know, I definitely don't want my loved one to be in a nursing home for 30 days, but gosh, 24 hours sounds terrible too. It's not really 24 hours. The way they've got it set up is that you have to be in the nursing home for 2 hours on one side of the day and 2 hours on the other side of the day. So what's that mean? I don't know. You go in at 10 o'clock at night and you come out at 2 o'clock in the morning.
Yeah.
Right? So
this is my case.
Yeah.
I come in at 10 and I leave at like 12, 1
right.
o'clock.
Yeah. So you just have to be on both sides of the day. That's how they've kind of finagled it to where you don't have to actually be in the nursing home for 24 hours. Usually you're able to transition out of MDCP when you're about to turn 21 to something like Star Plus Waiver, unless you have another waiver that you'd like to stay in. You know, if you're in Children's Medicaid and you're in another waiver, then there may be certain circumstances where you want to transfer to Star Plus Waiver, especially because of the nursing issue, nursing care. But if you're in MDCP, you know, and you're receiving nursing, probably a good idea to be in Star Plus Waiver as an adult. Some people have said it's automatic. Okay, the state will begin transitioning about 6 months out, but that doesn't mean you're going to meet medical necessity for Star Plus Waiver, even though it's the same medical necessity criteria for MDCP. I've had cases where individuals were in MDCP, same medical necessity criteria, but then they were evaluated for Star Plus Waiver by a managed care organization for, before they turned 21 as part of that transition process, and they didn't meet medical necessity. Wait a second, it's the same criteria. What happened here? So a lot of arbitrary capricious decision making by Texas Medicaid and Healthcare Partnership makes the medical necessity decisions, both these programs, MDCP and Star Plus Waiver. That's why I say it's not automatic. Don't ever count on anything being automatic. It's my opinion. Okay, class, community living assistance and support services. This is an alternative to intermittent care facility for individuals with IDD or related conditions. Again, same thing, institutional income resource limits, they don't take into consideration a parent's income. This is for child and adults with developmental disabilities that occur before the age of 22. The cost cap for this program is 200% of an ICF IDD RC, which is currently about $114,736.07 per year. That's the top of the budget. That's the cap. And you have to have a related condition and a monitor extreme deficits and adaptive behavior. That's the criteria for eligibility for the waiver. And you have to have a demonstrated need for rehabilitation and case management services. Okay, these are some of the services in class. I'm not going to go through every single one of these, okay, guys, because it's a pretty long list. But I mean, it does have rehabilitation services. You do have some employment assistance, therapies, modifications, specialized therapies is a very big draw for class. They have massage therapy. They have hippotherapy, all kinds of different therapies. People are very happy with the different therapies that they can receive for their loved one with class. A lot of the other waiver programs don't have the kinds of specialized therapies that class pays for. And when they have to move from another waiver, because you can't, also, I think I say this on one of the slides, but you can only be in one waiver at a time. You can't be, if you're in class, that's the only waiver you can be in. There are waiver to waiver transfers. Normally it's Class or HCS transfer to Star Plus waiver, that type of thing, or MDCP when you age out into Star Plus waiver. But a lot of people are, it's kind of sad when they have to move their loved one from class to Star Plus waiver because they lose those specialized services, because Star Plus waiver doesn't have that type of service. Okay, some important facts about class. It is available statewide, but there's kind of a small provider base historically. You have to have like 2 different agencies in whatever area you're in. You have to have a case management agency or a CMA, and then you have to have a direct services agency or DSA. So the case management agency, it's my understanding they help to develop the yearly plan and submit it for approval with the state, and then the direct service agency has all the services that you would need. They help provide the therapies, and help provide any nursing services, any of the services that you need, they would provide those. And again, the individual cost ceiling is 200% of the average ICF IDD cost. HCS, Home and Community-Based Services, the waiver that my boss calls the Cadillac waiver. Because it's got a lot of great services. Plus, what's the issue? That nobody's coming up with a list. The state hasn't given any money. People are 10,000, 9,000. That's their number when they call every year. Hey, what's my number? It's still 12,255.
13 and a half years we waited.
Right, but I mean, I am very happy to hear that your loved one is on the HCS waiver, but 13 and a half years they waited. That's Texas. That's shameful. That's terrible. That individuals are just on this list and not receiving the services that they need to receive. It's an alternative to ICF and IDD institutionalization, much like class. Same thing about the institutional income limits. Now, the criteria for this waiver is you have to have a primary diagnosis of intellectual disability and an IQ that's either 69 or below, or you can have a related condition, an IQ of 75 or below. So if you don't have an intellectual disability, but you do have a related condition, you can have a little bit higher of an IQ. Now, there's another way you can get an HCS if you're transitioning or diverting from a nursing facility with PASSAR or pre-admission screening and resident review. That's a program that the federal government says that the state has to follow for individuals who are either in nursing homes or about to go to a nursing home, to screen them to see if they have intellectual disability, mental illness, or related condition, in order to either divert them from a nursing home into HCS, into the community, or provide those specialized services that would otherwise be provided in the waiver in the nursing facility, okay? But for that, you have to have a related condition and a monitor extreme deficits in those 6 adaptive behaviors we talked about under related condition. The thing about this is that if you can have a related condition and not have an intellectual disability, to be diverted with PASSAR from a nursing facility into HCS, which is good. The cost cap is based on LON, or level of need. And these level of needs have never made a lot of sense to me, but 1, 5, and 8 has that budget limit of 167,468, and so on and so forth. Level of need 6 and level of need 9. Level of need 9 is 305,877. I don't see level of need 9 very often. You gotta have a lot of severe behavioral problems, hurting yourself and others is my understanding, in order to receive a level of need 9. Okay, here are some of the HCS services. The big draw of HCS is the residential assistance that it provides. No other waiver provides this kind of residential assistance. Supported home living, foster companion care, residential support in group homes. Though that's the main draw. A lot of parents, and I don't fault them for this, they're worried about what's going to happen to their loved one after they pass away, because I mean, that's just the reality. You have an individual that might have Down syndrome, and the parents are getting older and are, either having trouble taking care of their loved one in the community, or are worried about what's going to happen to their loved one whenever they die. And so HCS has this residential component that can help provide housing to that individual when their parents pass away. We also have day rehabilitation, behavioral services, adaptive aids, nursing, respite, all these different services in HCS. Important facts, residential, again, services included in the waiver, that's the big draw for HCS. Case management is provided by the local authority. In this case, in Fort Bend County, would be Texana, and it's separate from the provider. There's HCS providers that help to provide the services, help to put together, along with the local authority, the plan for the year, what they call it, individual plan of care, or IPC. And then you can do consumer directed services for some things like supported home living and respite in HCS. Deaf, blind with multiple disabilities. This is also an alternative to an ICF IDD. This is for individuals who are deaf and blind, and then they have a third disability, resulting in demonstrated need for daily rehabilitation services. The cost cap of this is also 200% of an ICF, and it's the same cost limit as class. I've never worked with this waiver. I've heard of it, but I've never worked with it for a number of reasons. There are residential services in this waiver, but there's just the issue with this waiver, and here's some of the other services. But the issue with this waiver is just there's not a big incidence of individuals who are deaf, blind, and also have another disability in order to meet the criteria for this waiver. And you can do consumer directed services in this waiver as well. Just not a waiver I've ever worked with. Youth empowerment services. This is it's meant to be short term. I just learned the other day that this waiver is only meant to be good for a year. I didn't realize that until one of my colleagues gave me that information. This is for intensive community services for individuals who are like between the ages of 3 and 18 who have severe emotional disturbance. Now, that's an SED, and what is that? That's a diagnosable medical, behavioral, or emotional disorder which results in functional impairments. It's now statewide. A few years ago, it was only limited to certain Texas counties, and now it's statewide as of a couple of years ago. The whole point of this is it's supposed to be an alternative. Remember how we said we waive off things, right? We waive off an ICF, we waive off a nursing home. Well, this is waiving off inpatient psychiatric care for individuals who are, they have the SED and they have a lot of problems that would normally, they would be an inpatient. And they have to meet this certain criteria, including risk of self-harm, risk of severe disruptive or aggressive behavior. My problem with this is if it's only for a year, what happens if these individuals still have the same problems and the possible need for inpatient psychiatric care after that year? So I have an issue with that as far as this waiver goes, being limited to just 1 year.
I have a question about qualifications. Is there any financial or asset threshold?
I think it's the same as the other waivers, the 300% if I recall. Here's some of the services. This is very focused on psychiatric care. So almost all the services or like at least half are based on that. Texas home living. This is an alternative to an ICF IDD. This is almost like I can't even call it HCS like. It's just the bare minimum amount of service to help individuals stay out of ICFs and remain in the community. It's just not much there. You have to already be Medicaid eligible prior to enrollment. I don't know why that is. I have never been able to really figure out why that is. And that causes some problems because it doesn't work like the other Medicaid waiver programs like say MDCP, where a child can become Medicaid eligible because they meet medical necessity for the waiver. It doesn't work like that in Texas home living. You already have to be receiving Medicaid in order to receive Texas home living. Is that?
I've got that. Yeah.
Right. So, and your child receives SSI, correct?
Yes.
So they're already Medicaid eligible, right? Because they receive SSI, they receive Medicaid, already Medicaid eligible, then they can get Texas home living.
For that one, they needed the waiting list too for years. For this one,
The waiting list is not as long. Okay, but there's services, but you said your child's in MDCP?
mine before he's denied last year.
Oh, I'm sorry to hear that. I work a lot with denials. doesn't really make a whole lot of sense where things don't change from year to year, and we can talk about that. You know, and then you meet medical necessity 1 year for MDCP, and you have the same issues, it's the same medical necessity criteria, but all of a sudden you don't meet medical necessity the next year.
Mm-hmm.
That's a big problem.
It's very hard to use this.
What's that?
It's very hard to use this because the fees are so low.
Are they?
You almost
Okay.
have to supplement.
Yeah.
That one is when you have it in the HMA rate?
Yeah, yes, this would be through the local authority, or in Fort Bend County would be Texana.
Texana.
Yeah. They're the service coordinator for this program. The cost ceiling though is kind of low, it's 17,000, so you can only fit so much, and essentially you're probably gonna use a lot of like attendant care and respite and rehabilitation services in this waiver. But the Medicaid rates, the Medicaid rates, like this gentleman was saying, are so low that it's hard to get like, you know, qualified people in order to provide the services, especially if you do consumer directed services or an agency. If you do consumer directed services, you can set the rate out of whatever the base rate is, you can set the pay rate. But if the pay rate is so low, then sometimes, you know, you can't really, you know, do any better than an agency would do. Sometimes you can though. What were you gonna say, sir?
No, that's basically what I was gonna
Oh,
say,
okay.
yeah. Sorry.
Okay, here are some of the services that you can get, a lot of very similar to some of the other waivers. But, I mean, it has nursing on there, and it has respite, it has therapy services, but it's got a low budget limit, so you'd have to really be careful on what services you utilize over and above the state plan. Some important facts, like we just said, limited services and cost ceiling. It's kind of been known to be a subset of the HCS, because everybody that's in Texas Home Living really wants HCS, right?
Yeah.
You can remain on the HCS waiting list. You can remain on any of the waiting lists for these programs, and consumer directed services for all the services. Star Plus waiver, which again isn't really 1915C anymore, but I think it's still important to talk about. Excuse me, it's alternative to nursing facility. These are for adults 21 or older. Institutional income resource limit's the same. Cost cap is 200% of individual resource utilization group or RUG level. The RUG level is determined by the assessment form that is used to determine medical necessity, and then you get this RUG level. And then this still works. This is the cost limits for the program. Now, you have 3 different subsets of cost limits in Star Plus waiver. This, in my opinion, is the best waiver. Although it doesn't have much of a residential component, it's the best waiver for individuals who are highly medically fragile in the community that need a lot of nursing services. So there's 3 different subsets. There's the base cost limit for people who don't have a ventilator. Then there's a category for individuals who use a ventilator for 24 hours a day, and they get a cost limit bump to a higher cost limit. Like say, for example, if you had a RUG limit of SE2, which, you know, roughly means you have a gastric tube and you need suctioning, and you have all these other different issues, right? Now, your cost limit in the base rate, if you didn't have a ventilator, is about $153,277. If you have a ventilator for about 24 hours a day, I can't remember that one off the top of my head. That one's probably, I think it's like, let's just say it's like 230,000, okay? That's a big jump from that base one if you didn't have a ventilator. And then the other category is if you have the ventilator for less than 24 hours a day, 6 to 23 hours, or I think they may have changed it where it's just now less than 24. That one is, I think, 191 to 11 or 277 or something to that effect. And so you do get a bump for the ventilator add-on. The other waivers don't have that, okay? So if you're, say, in class, I have this going on right now. If you're in class, remember the budget limit was only 114,700 something, right? But you're in children's Medicaid, you receive private duty nursing through state plan, because it's state plan service for kids. You're about to turn 21. Nursing services are not a state plan benefit for adults. Got to get it from a waiver. Class is only going to give you 40 hours, but you need 120. You got to get it from somewhere else. You can't stay in class because they're not willing to give you the number of hours that you want. Then you got to transition over to Star Plus waiver and hope that you get a decent number of hours under the better budget. There is a way to stay in a waiver over and above a cost limit. Okay, let me kind of back up a little bit. You cannot start off the plan year in a waiver with a individual plan of care over the cost limit in the waiver. You can't start out that way. You can spend more money throughout the plan year if like acute needs arise. But you can't start out the plan year that way. So let's use Star Plus waiver as an example. Okay, so a lot of kids who are aging out have, let's just use an extreme example. A child needs 24/7 nursing in the community and Children's Medicaid. No problem with Children's Medicaid, state plan service and no cost limit. So however much that's costing the state per year, it's being paid for. Let's say that costs $275,000 a year, okay, and they're on the ventilator. When they move over to Star Plus waiver, remember that cost limit's only like whatever it is. Let's just say it's $230. Well, their plan of care is going to be over that cost limit. There is a way, there is a mechanism to be able to have that child stay in the community and receive the services even though they're over the cost limit. It's called General Revenue Fund process. And we can talk about that another time, or you can ask me about it offline. Here are some of the services in Star Plus waiver. Adaptive aids, adult foster care, although that's not utilized very often. Assisted living, nursing. That's the big one, the nursing. Because, again, private duty nursing services is not a state plan service for adults in Medicaid. Skilled nursing service visits are, but that's temporary. That's meant to be for acute needs. Like if somebody has a stroke in the community, they're hospitalized, and maybe they come out of the hospital and they need for a short period of time in order to recuperate and for therapies and everything. They also need some nursing for a short period of time. It's only meant for acute care needs. It's not meant to be something that's long term. That's what Star Plus waiver's for long-term care services, for nursing, that they would receive on a regular basis in a nursing facility if they didn't have this program. You can also get therapies. The difference between, but Terry, you told us that you can't have the same services in the state plan as you do in the waiver. Well, I thought you could get PT, OT, and ST in the state plan. You can, but the adult PT, OT, and ST is only for acute needs. Like again, the stroke, and that you're getting better, and now you don't need the PT, OT, and ST anymore. Physical therapy, occupational therapy, or speech therapy. The PT, OT, ST in the waiver is for long-term care to maintain what you already have, what you have. And this is really important for individuals who are aging out, children that are aging out from a children's Medicaid program into the adult Medicaid program, who need PT, OT, ST to maintain where they are. Because if they don't receive these services, what happens? They regress, right? And a lot of managed care and Texas Medicaid sometimes forgets that this PT, OT, and ST is for maintenance, and it doesn't have to be for acute care services like it is in state plan. Respite care is a big one. Dental is a big one. Believe it or not, and you guys probably already know this, dental services are not a state plan service for adults in Medicaid. It is sometimes a value-added service to a managed care organization, like they're trying to hey, come on over to us, because you have a choice of usually 2 or 3 in the region where you are in Texas. They'll be like, hey, come on over here with us. We got a little bit of dental you can get, because it's not a state plan service in Medicaid for adults. It is for children. We see that all the time. I mean, children can get just about anything they need as long as it's medically necessary in children's Medicaid. But when you become an adult, dental is not a state plan service. And so the value-added service that a managed care organization will be a little bit of money for checkups and things like that. This dental is a little bit more. In Star Plus waiver, if I recall, it's up to $5,000 per year. So that can provide a wider array of dental services if somebody needs it. Emergency response services, also transition assistance services, again, for those individuals who are leaving nursing facilities, if they're coming out of the nursing facility onto something like Star Plus waiver. This is transition again for a lot of individuals, for kids who are transitioning usually from MDCP the Star Plus waiver, because you can't be an MDCP after the age of 21. Also, it's, you can use consumer-directed services for nursing, attendant care, and therapy. I normally see the consumer-directed services used for attendant care, but I have seen it used for nursing. It's a little bit more challenging because you have to find the nurses, you have to find all these employees yourself. And sometimes it's hard to find the nurses. There's some pros and cons to CDS. The pro is that you can pay usually a little bit more than an agency can. So the agency, let's use an example. Nursing for LVN, the base rate is $29.69 if it's not specialized nursing. Okay, so let's just say $29.69. Well, a nursing agency is a business, and they have administrative costs, and they have their lights to keep on. So they're going to take some of that money off the top. And so they may only pay the nurse $19, right? So they're taking $10 away from the rate. Well, if you do CDS and you hire that same nurse, you don't have those same administrative costs. So you can actually pay that nurse a little bit more money than the agency could. That's sometimes a draw to get the nurse to work for you, but some of the downsides are you can't pay overtime, and you can't usually you can't provide health insurance for that individual. So there are pros and cons to doing CDS, especially for nursing. This is Star Plus Waiver is a mechanism to help people move from nursing facilities into the community. And again, we talked about that dental benefit. That's really important for individuals. Interest lists. They do track these interest lists and tell you how many people are on the interest list for the different waiver programs. How long they give, like, they have categories, and I checked the link and it still works. They'll give different categories of like how long somebody's been on the waiting list, and it's depressing, guys. Like, this is I don't like going to this website because it shows how many people are on these waiting lists, how long they've been waiting, and how many people have come off the waiting list for that year or that maybe a quarter. You know what it says for HCS? 0. I'm flabbergasted. Now, there are people coming off the waiting list for things like MDCP, Star Plus Waiver, Class, Texas Home Living. People are coming off those waiting lists, but not for HCS. They just won't provide the money to make sure people can come off the list. There are other ways to get HCS. We did talk about the PASSAR diversion. There's also a way if your loved one is having like a crisis and they're at like almost immediate danger of being institutionalized in a state supported living center or an ICF, you can work with the local authority sometimes to get a crisis diversion slot for HCS, but you have to meet certain criteria, and the local authority has to be able to figure that out and do that right. It doesn't always work though. Some local authorities work better than others when it comes to that crisis diversion slots for HCS. How to get on the interest list. We talked about that earlier, and this is the slide that I was talking about. For HHSC, this 1-877-438-5658 is the interest list number to get on Class, MBCP, and the deafblind multiple disability waiver. Okay? You can get on, also, I need to add that, I apologize. Because there's now a waiting list for Star Plus waiver, this is the number you call for that as well.
So question on that. So for the last one, Star Plus waiver. Right now, my son is 11 years old.
Right.
So I need to call right now?
I mean,
or because he don't have any waiver.
He won't be able to get Star Plus waiver until he just turns 21 because it's an adult waiver. I'm sorry if I left that out. For Star Plus waiver, it's age 21 and up.
So when he's turning almost 21 is when I need it.
Yes, right.
And it's in a waiting list too.
I'm sorry?
Is that a waiting list?
Yes, it's a little bit shorter than some of the other ones, but I think it's like 6 months to a year. Yes.
Is there any reason why I should put my daughter on that wait list since she's already in HCS?
I would say no. Unless your daughter has like significant nursing needs that you're not able to provide under the HCS program, then I would not put them on the Star Plus waiver list. Cadillac waiver.
I know. Covered my waiver.
So I think that you're, you know, you have HCS and you have the residential component that could be utilized at some time. There are a lot of great services in HCS. In my opinion, no, I don't think there's any reason to be on a STAR+ waiver waitlist. And then you call the local authority, in this case, Fort Bend County, Texana. If you're in Harris County, it's the Harris Center. For HCS, Texas Home Living, and YES, or WES. If you want more info on the waivers, they do, HHSC every year or twice a year, they'll come out with an updated list of, and it's almost like a chart, and they'll compare all the different waivers with a lot of the information that I've provided you. They also have a lot of information that kind of gets detailed on exactly what these services are. You know, just seeing a name of the service doesn't necessarily tell you exactly what that service is or what it's going to entail. And so this resource will provide you a lot of good information. And I did check that, and it still works. I think the last time they updated was August of 2018, if I recall. This is also a good website, the TexasMedicaidWaivers.com. It was somebody that we used to work with who was a class case manager. I don't think she is anymore. And she's a mother of individuals with disabilities. I think her name is Heather Bordeaux. And she was somebody we used to work with at Disability Rights Texas sometimes. And she has a website that gives some kind of user-friendly information about the different waivers, interest lists, and things like that. SSI. This is my information. If you would like to contact me, that's my email, my phone number. And if you have a issue that you think Disability Rights Texas might be able to help with, our intake line is 1-800-252-9108. Oh, is that all right? Does anybody have any questions?
I'm sure there's many questions. I'll go ahead. Thank you, Terry. Appreciate it.